Now, we're talking solutions to start things off tonight. We got a ton of feedback last night after the show. We focused on the crisis in Old Town, and it hit a nerve with a lot of people. We showed you the tents and the homelessness and the suffering and the addiction and the mental illness and the violence, everything. We spoke to the executive director of Lan Su, the beautiful Chinese garden down there, about the threats that she faces every day trying to keep her staff and her patrons safe.
I have had staff in the last week assaulted. I have had staff in their cars chased with people chasing after them with metal pipes. We had somebody die on the streets right next to Lan Su. We have had gunshots. All of this is too much to ignore and not address.
Yeah, so that was Elizabeth Nye there, the executive director, and she didn't hold back at all during our interview. There was one thing that she said in particular that really caught a lot of people's attention when I asked her about the city's response to her concerns.
I'm going to tell you something. Some of the conversation has shifted to everybody knows what the problems are, so don't come to me unless you have solutions. That's what we're being told. Well, I don't have the solutions. My job is to run Lan Su. Your job is to show up and make our city safe so that we can do that.
So let's try to help her out, okay? Let's talk about some solutions tonight. When it comes to our homeless crisis, a good place to start is mental illness and addiction. I met with Scott Kerman from the Blanchet House. They operate in Old Town, serving meals, offering shelter, offering services to people. There are few people, honestly, who know this crisis better than Scott, and he is very, very concerned. He says that all of the problems that typically plague homeless people have grown. They've gotten worse. To the point now to where the work that they do at the Blanchet House, they can't even hand out food on some days. They can't even give out coffee on some days.
There is so much mental illness in our area. There is so much addiction and so much trauma that it is becoming increasingly challenging for us to provide services and for people to receive services.
Frankly, because it's dangerous to do that at times. Old Town has our largest concentration of homeless people. Drug addiction is up, psychotic episodes are up. There is constant violence, especially against homeless women. I saw it. I went down there when I did those interviews. We parked outside, right outside the Blanchet House, and I stepped out of the car, and right there I saw a woman, a young woman, sitting cross-legged in the door of her tent, alone, gazing past me, clutching a hatchet in her hands. Trust me, whatever you see in stories like these, on The Story, on other KGW newscasts, on any newscast that you watch around town, believe me, the reality down there is worse.
Because if it's not in front of you, and if you're not down here all the time, you really can't appreciate what we're seeing. There are times when we see things in our district, and this was certainly true in the initial weeks and months after everything shut down in March of 2020, that were reminiscent of what you would see in news footage for war-torn or famine-torn areas, perhaps in developing countries. That was happening right here. People in half states of clothing, with illness, and sleeping in the street, and that's what we're seeing down here.
So what can be done? What are the solutions? How can we help these people and the people who live down there and work down there? Well, Willamette Week, they published an article this morning that we think is worth your time. Coincidentally, they were covering these very same issues in Old Town at the same time that we were, in a piece that's discussing solutions to what they call the higher rates of psychotic episodes that are occurring down there. They mentioned the county's massive bankroll to fund solutions, so it's not like there's no money sitting around. There's federal bailout money from COVID relief. There's $2.4 billion from that tax measure that passed last year, and $52 million that's ready to be spent. They also talked to Scott from Blanchet House, and his new idea he has to unite with the other nonprofits down there, to fight this fight together. He shared his full plan with Laurel Porter last Friday on Straight Talk.
Let's talk about some more solutions, Scott, because you're calling for a bold, innovative response. You wrote about it in a guest editorial recently in the Oregonian. What is your idea? What does it look like?
So my idea is that the agencies in our downtown and Old Town district share teams of mental health and peer support specialists, we see many of the same clients and guests, and we experience as individual agencies many of the same challenges in serving people who are in crisis. And we are fortunate to have an amazing peer support person with us at lunch and dinner 5 days a week. And it's amazing what her building relationships with people who come to us every day has done to enhance their experience with us and help to de-escalate crisis. Imagine if that existed everywhere, and that when people went from Blanchet House to another agency for service, they also saw the same people. We would have this continuity of care from agency to agency, and we'd be able to collaborate in helping the people that we serve collectively to better outcomes.